just stay on schedule with those, and then our lectures we're gonna be like one off per week or something.
Okay.
Yeah, yeah. That way you at least get all the information. So we have enough wiggle room, luckily, because of what happened. So we'll be okay. All right. So like I said, usually all this means is that the coronary arteries. So again, we're still talking about the coronary arteries. So in acute coronary syndrome and coronary artery disease, it's the same thing. I mean, the same location. And that's the vessels that deliver blood to the heart itself. So with this disease, like it says here, the vessels themselves are narrowed, and that's usually because of a buildup of plaque. And plaque really is like a layer of fat inside the vessels of your coronary arteries. Uh, and so the best way to think of this is that if you have coronary artery disease, your coronary vessels are like always constricted to an extent. They're always constricted to an extent. Um, so because of that, if you have this disease, there's a good chance you're not a very active person. And because of that, whenever you do exert your body more than it's used to, because you already have that extra layer of fat inside the vessels, when those vessels do constrict from extreme physical activity, um, you're you're gonna cut off circulation, or not, maybe not complete, but partial circulation to certain parts of the heart tissue, because the vessels are already kind of naturally constricted with this extra layer of fat. But as soon as the person relaxes, though, that's the good thing about coronary artery disease, is that as soon as that person relaxes, the vessels will go back to their natural size, which are, kind of naturally constricted already because of that layer, and that pain will go away. So with coronary artery disease, your patients get what's called stable angina. So that's that chest pain from cardiac, from a lack of oxygen, but it's stable. And the reason it's stable is because as soon as your patient relaxes, it goes away. Now with acute coronary artery disease, the one we're talking about, that we get what's called unstable angina. And that's because it doesn't matter what else the patient does, if they relax or not, that pain is gonna be consistent and is not gonna go away. So that's the difference between stable angina and unstable angina. Does anybody have any questions about stable angina or unstable angina at all? No? All right. All right, so thrombus, occlusion of blood flow caused by formation of a clot on a rough inner surface of diseased artery. So that's, I know I've given this example before in the class, but acute coronary syndrome can develop because of coronary artery disease. So because of that extra layer of fat inside the vessel, if even a little chunk of that breaks off, your body can see that as a cut, and then the platelets can start attaching to the sidewall of that vessel. And because the platelets will bunch up and the coronary vessels are so small, that can cause acute coronary syndrome. And that's where aspirin comes into play. So aspirin will take the stickiness away from the platelets and reduce or decrease the speed at which this is developing, if that makes any sense. So as far as emboli, right here in the bottom, that the last dot right there, emboli is another general term. So emboli is anything that obstructs a vessel. That's an emboli. So an emboli can be a piece of fat, so that plaque in the tissue, or it can be a chunk of blood that just kind of decided to just bunch up with each other. That it could be that too, or it could be anything else. But emboli, just think of, that's just an object. It could be any object, and that object is causing an obstruction to where blood can't get through a vessel. So that's what an emboli is. It's a general term for anything that causes an obstruction. So like even an air bubble, for example, could be an emboli. If air bubbles get into the bloodstream and cause an obstruction, the air bubble is now an emboli. Reduced blood supply to the myocardium. The myocardium just means muscle heart. The myo is muscle cardium heart. So cardiac muscle causes emergency in majority of cardiac related aneurysm. So an aneurysm is a weakening, the weakening of a vessel, and what happens is that the inner layers of the artery, the ends, because the vessels, so veins and arteries, they're made up of layers, right? It's like a water hose; it has layers to it. So do your vessels. Well, the inner layer of a vessel has weakened and gotten smaller, and that can cause a bulge. And then that bulge, just like in a water hose, when you see that the top layer is gone, and then there's a bulge from the inner layer of the water hose. That is exactly what an aneurysm is, but it's happening inside your body, and can burst. And once it bursts, depending on where the location is, it can be very, very deadly. I did find a video on that, so I'm gonna share that with you guys real quick on